Hi guys, and welcome back to our YouTube channel. I look after our emergency medicine team here at BDI, based here in London, and today I want to talk to you about different middle grade contracts for emergency medicine doctors, not just joining the NHS for the first time, but also if you're working in the NHS and you want a new contract and you want to know the difference between the types of contracts, okay? So the first type of contract that I want to talk to you today about is the desirable specialty doctor contract, okay? And a really important distinction about this type of contract, it's based on a PA system, okay? So you're very likely that you've heard of a 10 PA contract or a 12 PA contract. They're the most common within emergency medicine, and I want to tell you a little bit about those and also how the salary is calculated for this type of contracts. It's really, really important. We get questions about this all the time, and it's especially important to emergency medicine doctors. Perfect, so what is a PA? A PA is a programmed activity. It's for 4 hours, okay? So for a 10 PA contract, you'd be working 40 hours. For a 12 PA contract, it would be 48 hours, okay? Now, not all of those hours are direct clinical. I know for some of you guys, really important you're not working 48 hours direct clinical, and I absolutely get it, but that's not the case. So you will have protected SPA time within those contracts, okay? So SPA time, that's supported professional activity, and within that time it's non-clinical work, and you can use that towards whatever you want to do, whether that's your CSER application, whether that is you want to take on some teaching responsibilities, some clinical audit. That is protected time, and it's up to you to negotiate that with your clinical supervisor about how you want to spend that time. So that's a really important thing about the specialty doctor contract and the PA system. So now to the juicy part I know you want to hear from me about, the salary. Okay, so how do they calculate the salary for a specialty doctor? Now this is really, really important because this distinguishes the specialty doctor contract from some of the other contracts that I will talk to you about in a moment. So first of all, with a specialty doctor contract, they will take into account your overseas experience, or they will recognize your overseas experience, okay? Now, one of the really, really important things to say here is for most hospitals, they will only consider your middle grade experience within that specialty. So it will only consider middle grade level experience and above working in emergency medicine. Okay, so you might say I've got 16 years of clinical experience, but if you've worked for 8 years in pediatrics and then you've moved into A&E for only 8 years, they are only going to take those 8 years in A&E, and they have to be middle grade experience and above. So you might be thinking, does the specialty doctor contract apply to you? And the truth is, even if you're a relatively junior middle grade doctor, you can secure a specialty doctor contract, but just bear in mind the salary might be on the lower side than if you were to take one of the other contracts. So usually what we'd advise, especially if you're working at a really senior level, you have over 10 years experience, then definitely consider the specialty doctor contract. This one definitely applies to you, and it should be considered. So what I want to share with you now is 2 really important tips. And the first tip is to ensure that on your CV, if you're looking for a specialty doctor contract, on your CV, before you submit it, make sure that you do state the grade equivalency for each position in your employment history. Now this is really, really important because this is the first thing that any employer is going to look at when they calculate your salary, okay? The second tip, also really important, a lot of the hospitals, they will ask you for experience certificates, okay? So whatever is on your CV, if you're stating that you're working at ST3 level or above, or middle grade level and above, you must be able to supply them with experience certificates, okay? So if you need any advice about how to obtain them, what that looks like, please do get in touch with us and we'll give you some more information. So the second contract that I want to talk to you about today is the specialty registrar contract. Now this is really, really important as well because it's very different to the specialty doctor contract. Now some of the responsibilities, depending on which department you're going into, they may be very similar to the specialty doctor contract, but the salary is calculated in a completely different way. Okay, so if you're joining a trust at ST3 plus level, then you will be starting on the salary of basic 51,000, and then you will be also given on top of that rota enhancements. Now the rota enhancements will be different at every hospital, they'll be different in every department. They will also may change over time as well, okay, and this is really important. So the rota enhancements are calculated on, first of all, weekends, how many weekends you would work. Usually you would be in an A&E department in the UK, it's 1 in 3 or 1 in 4 weekends, that's pretty standard. The second thing that they use to calculate the rota enhancements is any additional rostered hours over 40. Okay, so 40 hours. In reality, you could work up to 48 hours, but most hospitals, to keep the work-life balance good, you're looking at working somewhere around 40 hours. But any additional rostered hours, you do get also an enhancement for those. The third thing you get an enhancement for is working night shifts as well, okay? As an A&E doctor in the UK, whatever contract you take, you will be expected to cover night shifts, and that's also important to mention. So the third and final contract that I want to speak to you about today is the 1A banding contract, okay? So you've probably heard of banding before. All emergency medicine doctors, if they're on this type of contract, they will receive 1A banding. So what is 1A banding? Okay, so the first thing, you will have a basic salary, and then in addition to that, you will have an enhancement of 50%. Okay, and that's because you work out of hours, you work additional rostered hours, you will also work weekends as well, so you will be given a guaranteed 50% enhancement on top of your basic salary. So for example, if you were calculated at a certain point on the pay scale at 42,000 basic, your total salary would be around 63,000. Also 50,000 basic, 75,000. Really simple to calculate. So if you are wondering which contract is most applicable to you and you're a little bit unsure, please don't be afraid, get in contact with us. It's a free consultation. We can have a look at your experience and we can give you some guidance on what we think is the best contract for you. And also it depends on how many hours that you're happy to work and also what your salary expectations is. So there's lots of things to consider, but please do get in touch. So those are the 3 different types of middle grade contracts available to emergency medicine doctors joining the NHS. Thank you so much for watching. And if you have any questions, if you're a little bit unsure on which contract is most applicable to you, please do get in contact with us. Feel free to reach out to one of our recruitment specialists here based in London who work in emergency medicine. They will be able to have a look at your CV, give you a bit of guidance, a bit of advice based on what your preferences are, but also on your experience too. Okay, so please do get in touch. You can send your CV into our apply email and we look forward to hearing from you.